Good afternoon, dear students. The topics of today's lecture: anti-anginal drugs and antilipemic drugs. Angina pectoris is the most common condition involving tissue ischemia in which vasodilator drugs are used. The primary cause of angina pectoris is an imbalance between the oxygen requirement of the heart and the oxygen supplied to it via the coronary vessels, as you see on this slide. In classic angina, the imbalance occurs when the myocardial oxygen requirement increases, as during exercise, and coronary blood flow does not increase proportionately. There are two main causes of cardiac ischemia: atherosclerosis and vasospasm, but the most frequent cause of angina is atheromatous obstruction of large coronary vessels, atherosclerotic angina or classic angina. Look at overview. There are two main effects of anti-anginal drugs. First is reducing oxygen demands. Oxygen demand can be reduced by decreasing cardiac work and dilating systemic arteries and veins. And the second is increasing oxygen supply, which can be produced by dilating conduct coronary arteries and promoting regional distribution. Let's talk about classification of anti-anginal drugs. The main pharmacological group of anti-anginal drugs is nitrates. Nitrates include following drugs: glyceryl trinitrate, isosorbide dinitrate, and isosorbide mononitrate. The next pharmacological group of anti-anginal drugs is calcium channel blocking drugs. This group contains three main groups: phenylalkylamine, benzodiazepine, and dihydropyridine groups. These groups contain main representatives. Phenylalkylamine derivative is verapamil. Benzodiazepine derivative is diltiazem. And dihydropyridine derivative is nifedipine. This is another pharmacological group of anti-anginal drugs: beta adrenoreceptor blocking drugs. This group can be divided into two big groups: non-selective and selective beta adrenoreceptor blocking drugs. For example, propranolol is non-selective agent. Atenolol and nadolol are cardioselective agents. The next group of anti-anginal drugs is potassium channel opener, and the main representative of this pharmacological group is nicorandil. Dipyridamole is the main representative of next pharmacological group of anti-anginal drugs, drugs which can directly dilate coronary arteries. Let's have 1 minute break for relaxing. Coming back to our lecture, let's talk about mechanism of action of nitrates. Nitrates are converted to nitric oxide, which in turn activates guanylate cyclase and increases cyclic guanylate monophosphate. Increasing cyclic guanylate monophosphate facilitates dephosphorylation of myosin light chains, preventing the interaction of myosin with actin. Nitric oxide is an effective activator of soluble guanylate cyclase and acts mainly through this mechanism. The main pharmacological effect of nitrates is dilation of veins, which can lead to decreasing of preload and diastolic pressure in left ventricle, to decreasing of workload, and finally to decreasing of oxygen demand. The next pharmacological effect of nitrates is dilation of arteries, which can lead to decreasing of peripheral vascular resistance and to decreasing of afterload and systolic blood pressure, and finally to decreasing of oxygen demand. Anti-anginal effect of nitrates is followed by dilation of coronary arteries and improving of collateral coronary circulation, which can lead to increasing of blood flow to ischemic areas of myocardium and finally to increasing of myocardial oxygen supply. Here you can see pharmacokinetic parameters of nitrates in this table. For example, glyceryl trinitrate sublingual form show bioavailability of this drug is 76%. 3 to 5 minutes of onset of action, 20 minutes of half-life, and 10 to 30 minutes of duration of action. And thus, you can also see all these pharmacokinetic parameters of other drugs. Dear students, for the review of lecture materials, let's do a quiz. Please answer the following question. Glyceryl trinitrate can be administered by all of the following routes of administration, except first, sublingual, second, oral, third, intravenous, fourth, intramuscular. The main adverse effects of nitrates include headache, postural hypertension, facial flushing, tachycardia, and tolerance. As you see on this slide, tolerance of nitrates develops with all nitrates. It is dose dependent and disappears in 24 hours after stopping the drug. The calcium channel blockers inhibit the entrance of calcium into cardiac and smooth muscle cells of the coronary and systemic arterial beds. The main actions of calcium channel blockers are smooth muscle relaxation, decreasing of blood pressure, negative chronotropic, inotropic, and dramatropic action on heart. Anti-anginal effect of calcium channel blockers is related to inhibition of coronary spasm, decreasing of peripheral resistance, decreasing of afterload, and decreasing of oxygen demand. Antihypertensive effect of calcium channel blockers caused by inhibition of calcium influx and thus vasodilation in arterial bed. Antiarrhythmic effect of calcium channel blockers is related to inhibition of cardiac functions such as decreasing of heart rate, decreasing of AV conduction, and decreasing of contractility. Let's do next quiz. Please answer the following question. Beneficial effects of calcium channel blockers in managing angina. A. Increased preload. B. Reduced afterload. C. Decreased myocardial wall tension. D. B and C, and E. A, B, and C. Beta adrenoreceptor blocking drugs. They act by reducing cardiac work and oxygen consumption. Here you can see pharmacokinetic parameters of beta blockers. For example, atenolol, which is cardioselective agent, which can block beta-1 receptor selectively. Bioavailability of this drug is 40%, and half-life is 6 to 9 hours. And you can see pharmacokinetic parameters of other drugs. Dipyridamole is phosphodiesterase inhibitor. It increases total coronary flow by preventing uptake and degradation of adenosine, which is local mediator involved in autoregulation coronary flow in response to ischemia. Let's talk about antilipemic drugs. There are 5 types of hyperlipidemias. First type is characterized by increased level of chylomicrons. Second A, increased level of low-density lipoproteins. Second B, increased level of low-density lipoproteins plus very low-density lipoproteins. Third type, increased level of high-density lipoproteins. Fourth type, increased very low-density lipoproteins. Fifth type, increased level of chylomicrons plus very low-density lipoproteins. Let's talk about classification of antilipemic agents. Drugs decreasing mainly triglycerides or fibroic acid derivatives or fibrates, clofibrate, fenofibrate, and bile acid binding resins, cholestyramine and cholestyramine. Next pharmacological group of antilipemic agents is inhibitors of 3-hydroxy-3-methyl-glutaryl coenzyme A reductase inhibitors or statins. Representatives of this group are lovastatin, mevastatin, simvastatin. Next group, cholesterol synthesis inhibitors, niacin. Bile acid sequestrants bind bile acids in the intestinal lumen. Loss of bile acids stimulates hepatic synthesis of more bile acids from cholesterol. This group lead to decreasing of serum cholesterol and increasing of triglycerides. Indication for the uses: second A type and second B type of hyperlipidemias. Let's discuss another group of antilipemic drugs, statins. They competitively inhibit conversion of 3-hydroxy-3-methylglutaryl coenzyme A to mevalonic acid. This is rate-limiting step in cholesterol synthesis. This group leads to decreasing of low-density lipoproteins and total cholesterol. Indication for the uses of this group: second A type of hyperlipidemias. Let's talk about fibrates. Fibrates increase activity of lipoprotein lipase and decrease release of fatty acids from adipose tissue. This group leads to decreasing of serum triglycerides and increasing of high-density lipoproteins. Indication for the uses of this group: third, fourth, and fifth types of hyperlipidemias. The next drug of antilipemic drugs is nicotinic acid. Main mechanism of action of nicotinic acid. Nicotinic acid decreases production of very low density lipoproteins, and it decreases lipolysis in adipocytes. Main effects of nicotinic acid: it increases high density lipoproteins and decreases low density lipoproteins. Indication for the uses of nicotinic acid: second A, second B, third, fourth, and fifth types of hyperlipidemias. Here you can see effects of antilipemic drugs on lipids. For example, statins. Therapeutic dose of statins can reduce low density lipoproteins by 20 to 55%, increase high density lipoproteins by 15%, and decrease triglycerides by 10 to 35%. You can see effects of other antilipemic drugs in this table. To learn the materials of this lecture, you should review this presentation and learn databases of the tables. Your home task will be sent later. Thank you for attention.